All right, Dr. Galati, you ready? I'm going to introduce you. This is what I have, sir. So I'm just going to go with this. So Dr. Joseph Galati is a hepatologist and gastroenterologist specializing in liver disease and transplantation. He serves as medical director at Houston Methodist, and he's the founder of Liver Specialist of Texas. So he's a guy you need to get to know. He's passionate about patient education. He hosts a weekly radio program, Your Health First, where he shares practical health insights and promotes awareness around liver health and disease prevention. So I'm going to turn on over to Dr. Galati. Please give a big round of applause. Thank you.
Well, thank you very much. Thanks to Dr. Kadali for inviting me and the organizers. And I did not know about this organization until Sudha reached out to me, but I would congratulate everybody associated with the organization for doing such a yeoman's job in spreading the word on liver disease awareness and liver cancer and all the breakthroughs that are taking place here. Before I get started, I was just noodling on my computer last night, getting ready to come here. And I looked back and said, what were we doing in 1990 with regard to liver cancer? So back in 1990, from a liver transplant standpoint, we were doing maybe 100 transplants a year. And a lot of those cases were almost mistakes. We would find out the person had cancer after the transplant was done. Now we're doing, and you'll hear from my colleagues here, probably 25, 30%, if not more, of the transplants we're doing have an element of cancer. In 1990, it was only about 5% of the transplants we were doing. 1990, there was no standard criteria on how we would look at these patients for liver cancer. Now we have something called the Milan criteria, which was put out somewhere around 1996. Survival in 1990 was maybe 35% at best. Today, it's equivalent to other types of liver disease that we transplant. In 1990, you just waited to get transplanted. Now we have all kinds of therapies that we could offer our patients. In 1990, like I said, you just waited until you got your transplant. Now we have the MELD score, which prioritizes patients with cancer. And in 1990, the medicine to prevent rejection was mostly cyclosporin, which may not have been the best drug for cancer patients. And now the immunosuppression, the anti-rejection, is very refined and allows us to have much better results. And so really in the period of my career, in a sense, we've made just amazing breakthroughs. All right, this is the liver. It's not the prettiest organ in the body, not exactly a sexy organ to look at, but this is the liver. You can see how the gallbladder is attached to the liver and the bile ducts. And so this is what we'll be talking about here. Now, I show this slide. This is, your basic anatomy slide of the liver and the digestive tract, the colon, small bowel. But every single thing we put into our body will flow and filter through the liver. So you have to think whether it is alcohol, whether it is food, whether it is other potentially toxic substances, everything is going to flow through the liver, be acted on by the liver, and it may be a beneficial effect or it may trigger some inflammation or damage. Now, these are sort of a short list of the different diseases that we will see patients with. Everything from viral hepatitis A, B, C, D, and E. There's a host of autoimmune diseases. There could be too much iron or copper in your body. These are more genetic type problems. Alcohol, fatty liver. But what all of these, or just about all of them, have in common is that they are going to trigger a hepatitis. They're going to trigger inflammation in the liver. Okay? So these liver diseases, most of them here, will trigger a hepatitis. So what I always like to say and talk to my patients about is it's one of those itis words. And we have all had one or more of these itis words, and it's dermatitis, meningitis, diverticulitis, bronchitis, appendicitis. Basically, the way the word is broken up, it is inflammation of that part of the body. Okay? So if you have dermatitis, it's inflammation of the skin. If you have appendicitis, it's inflammation of the appendix, and so on. So here, this is a picture of the liver under the microscope, and those little guys there are what we call hepatocytes. These are the basic cells of the liver. And so if you have inflammation of the hepatocyte, that is hepatitis. That's all that it is. And so when we see patients and we tell them, you have hepatitis. Now we have to clarify it with what type of hepatitis. Usually people fall off their chair because they're thinking, oh my Lord, I'm infectious. I'm going to spread to my wife and my little grandson. No, that may be a hepatitis that is of infectious origin, like let's say hepatitis A or B or C. But hepatitis simply is just inflammation of the liver. You then have to qualify and say, what is the cause? Is it alcohol? Is it too much fat in your liver? Is it too much iron? Okay. But the key thing here is that chronic hepatitis that goes on for a period of time, be it 6 months, be it a year, be it 5 years, be it a decade, that inflammation of the liver is what can lead to cirrhosis. Okay? And cirrhosis is the end effect of inflammation that leads to scar tissue in the liver. So again, when we see patients and we tell them that your CAT scan or ultrasound looks like you have cirrhosis, what's the first thing they say? I never drank. How dare you accuse me of being an alcoholic? And we're like, no, I didn't say that. So alcohol accounts for maybe 49, 50% of all the cirrhosis we see. The other 50% or so is related to viruses, autoimmune disease, various genetic abnormalities. And so you see here, how does cirrhosis develop? And so you got the normal liver on the left-hand side, you have normal blood flow, everything is going well. Things are hunky-dory in the liver. But as there is injury, there is that hepatitis from fill in the blank, whatever the cause is, you get inflammation, because that's what hepatitis is, and the body's response to inflammation anywhere in the body is to make scar tissue. Now, we could live with a little bit of scar tissue in the liver, but when it becomes to the point that the liver is nearly replaced with scar tissue, all the healthy hepatocytes are gone, then that is where you have cirrhosis. And you can see on the right-hand side, the liver that has cirrhosis tends to be shrunken, tends to be small, very lumpy, bumpy. Those, what we call regenerative nodules, are on the surface of the liver, and you get abnormal blood flow through the liver. Because of the scarring, the scar tissue literally squeezes the blood vessels, the small blood vessels, so that blood does not properly flow through the liver, and that sets up a whole cascade of problems that we see with cirrhosis and a condition called portal hypertension. So here, what we're looking at is injury, and the liver tries to repair itself. Injury and repair. And as I said, this could go on weeks, months, or decades, ultimately leading to cirrhosis, but this is what liver cancer may look like on imaging study of the liver. That circled area, quite abnormal appearing compared to rest of the liver. That is what hepatocellular carcinoma looks like. So the risk factors for liver cancer, which you'll hear others talking about, is certainly cirrhosis, hepatitis B and hepatitis C. Alcohol is certainly a carcinogen, which will increase your risk of liver cancer. Too much iron, things in the environment, aflatoxins, tobacco, obesity, and now the biggest sort of public enemy number one is fatty liver related to the whole obesity crisis that we face here. So not to steal the thunder from Dr. Heine, our distinguished oncologist here, but why does this happen? And so there's all kinds of abnormal things that are going on inside the liver and in the liver cells. That one term there, dysregulation of hepatocellular differentiation. The hepatocytes are programmed to make other hepatocytes, just like, their brother or sister right next to them that's normal, doing all of the normal function. But somehow, with this inflammation, they get the idea that we're not going to be the same. We're going to be just a little bit different. And that is the groundwork for cancer developing. And that happens anywhere in the body. It could be breast cancer, lung cancer, bone cancer, leukemia, whatever. And the immune system becomes dysfunctional because the immune system really is the police to watch out for these abnormal appearing cells that develop. And really, as this all progresses, there's all kinds of genetic modifications, oxidative stress, free radicals, inflammation. And as I put here, this is a very hostile environment in the liver where things are going to go berserk. So the normal, very logical, very orderly function in the liver gets all turned upside down. Cells are not doing what they're supposed to do. They're not behaving the way they're supposed to, okay? When the liver cells wake up in the morning, they have their marching orders. All these reactions are supposed to take place, but when you're in this state of chaos, this hostile environment, everybody starts doing what they want to do. You get chaos, cells don't mature properly, and you eventually are at risk for cancer. And so again, the tumor suppression, there are proteins that suppress tumors from growing. We're all sitting here probably with some abnormal precancerous tumors in our body somewhere, but there are proteins, hormones, whatever it may be, that are signaling to say, that's abnormal, get rid of it, and we're okay. We never know any different. But those simple reactions are abandoned and the cancer is allowed to take over. So pretty simply, how do we prevent liver cancer from developing? Okay, can we? All right. Well, I would say for the consumer or the patient, it all comes down to awareness of the risk factors. You have to be sitting there or go talk to a neighbor or a coworker and say, are you at risk for liver damage? Are you at risk for inflammation in the liver? Are you doing something that is putting your liver at risk for inflammation? Okay, do you have some genetic predisposition in your mother, father, aunts, and uncles that may put you at risk? So it really is awareness so that we could act early. We have to continue to screen. Now, again, I would like all of you, the community at large, to be aware so that you can, in a way, self-screen. Realize that you're at risk. Realize that you may have a family tendency or something in your lifestyle behavior that's putting you at risk. I need to go get screened. Early diagnosis, and it doesn't matter what it is, early diagnosis is going to be the answer to prevent that inflammation from going on instead of a few years to a few decades. Okay? It is, in a sense, a game against the clock. Get expert opinion. A lot of people, Texas is a big state, it's a big country. They want to stay in their neighborhood. They don't want to venture out. So you may be getting good care locally, but really that expert care may be an hour, 2 hour, 3 hour drive away. You have to seek out the best care to get early diagnosis and appropriate treatment, early intervention, treatment, the opportunity to try to reverse this. We can reverse many facets of liver disease. Avoid the liver toxins, alcohol, various environmental, and then, of course, diet, nutrition, and weight loss, which, again, I can't overemphasize the obesity epidemic. Well over 100 million people with fatty liver disease. Many of those may progress to cirrhosis, and then, of course, that continuum to get to liver cancer. So for me, to set the stage for the others, I think we are off to a good start here. But I would say for all of you, it is awareness, realizing what your personal risk factors may be, get intervened. There's no such thing as just a touch of fatty liver or a touch of your liver enzymes being elevated. I think we have to say, if there's something wrong, even if it's a touch, even if you feel well, even if you look good, you're still doing an Ironman competition next week, you still have to get it looked at. This slide won't move. Anyway, how do I get to the last slide? There you go. So there's a QR code. If you want to scan that, I have a lot of patient, consumer information on liver disease and health and nutrition. Feel free to take a look at all that. But really what I would say is all of you here continue to be motivated, to be engaged and advocate for yourself. That really is the main thing. If it's not for yourself, it's your circle of influence, your family and loved ones. So, thank you very much. Appreciate it.